first thing I'd like to say is I want to thank all of you for coming, because we're very saddened by this story. This was a terrible event that happened last night, and first and foremost, I want to extend not only our heartfelt concern, but our prayers to the family of our paramedic and hope for his complete recovery. And let me just say up front that at the request of the family, we're not going to be announcing his name today. Just want to be sure that you're all clear with that. I think the best spokesperson for this today is Jim Island, but I'm proud of the men standing behind me. I think it's all men, and the work that they do. You know, we ask a lot of them, time and again, to give of themselves, and they always have and they always will. So a circumstance like this is not anything we look forward to ever having a press conference on, but it's very important. We want to be sure we get the right message out there. So again, thank you for being here. Jim.
Thank you, Mayor. Good afternoon, and just to echo what the mayor said, our thoughts and prayers right now are with our paramedic and his family, as well as the patient who lost his life in the ambulance and in his family. You know, this started out as a routine call in Kailua. The ambulance responded and was taking the patient to the hospital. We don't know why the fire started, but it happened, as we mentioned before, just entering the property of Castle Medical Center at Venice Health. The EMT, driver of the ambulance, immediately jumped out and opened the doors to render aid. The paramedic was able to escape from the ambulance, although he was critically injured, and the patient was unable to be saved. At that time, the fire was just too intense. The Honolulu Fire Department, as well as other EMS units, promptly responded, and we thank all of our teams and our crews, as well as the Honolulu Fire Department, for their prompt response. The Castle Emergency Room staff was there to immediately render aid and assistance to everyone, so we really appreciate them as well. After our paramedic was stabilized, he was transferred to Straub Medical Center by our Waimanalo EMS unit, and we're also very grateful for the team at Straub and the care they're providing. We had the help from the Honolulu Fire Department, the Honolulu Police Department, American Medical Response, the private ambulance provider, has able to stand up some units to help us. They have a unit in Kaneohe now supporting our windward operations during this time for us. So we're very appreciative of all our brother and sister agencies helping us, as well as the outpouring of support that I and the other team members here, with all the other EMS chiefs, really from around the country. You know, we've had representatives from the Big Island Fire Department come by, as well as local fire and police agencies, as well as just well wishes, condolences, offering of assistance from all our local hospitals, as well as you know, different international organizations to support our team, and specifically our paramedic who's in the ICU at Straub right now. So again, it was just a really rough night for all of us, you know, and again, the whole team gathered at Castle to support our paramedic and the family of the victim who passed away. And we're going to still be there to support the family, but out of respect for their wishes, we are going to keep his information private right now. But I will say he's a family man. He's a 10-year veteran of our department and well-respected paramedic and member of our team. You know, EMS is busy. We run over 100,000 calls a year in Honolulu, and we do that year after year, and we've done that for decades and decades. And in my experience in EMS, I came into EMS in the 80s. I haven't been in it consecutively, but this is nothing I've ever seen before. And in discussing with our chiefs here, who cumulatively we have hundreds of years of experience in EMS with all of us put together, none of us have ever seen anything like this. And so, you know, we're thankful for the agencies we're partnering with for the investigation. The Honolulu Fire Department is the lead agency, but this morning we were in contact with the National Highway Traffic Safety Administration, as well as the ATF. And we're making all records available to these agencies because I want answers, we want answers, because we want to know what happened and we want to make sure this never happens again. But until that investigation is done, anything I could say today would only be speculation and it would be inappropriate. So we're going to wait and let the professionals investigate this, but we're just as eager for answers as everyone else. So that's all I have today. I'll be able to take a few questions, but again, if it's anything related to the investigatory process, I'm going to have to defer to that, and we won't be really releasing any information on both the patient who passed away in the ambulance or our paramedic, out of respect for the privacy, just like we honor the privacy of all the patients we transport.
Dr. Arlen, I have a have the unions expressed their concerns about this, and I don't know if, have you been able to address their concerns from this incident?
Well, the paramedics are represented by the UPW, United Public Workers. I understand we've been in contact with them this morning, but I haven't received any express concerns from them, but we have been in contact with them.
Dr. Arlen, so I know you don't want to speculate, but could oxygen tanks be involved or defibrillators or anything that could have sparked something that caused an explosion?
Again, I think when you look at the investigation, everything is on the table. And by everything, I mean anything to do with the vehicle, anything to do with anything that's carried on the vehicle, and that includes our medical equipment. So I think everything's on the table, including what you just mentioned. But that list is long, and that's why we look to the fire investigators who are professionals in this in the Honolulu Fire Department. They do this, unfortunately, routinely on any serious fire they go on. And so we're going to look to them, and we're going to be patient because we want answers, but we don't want to rush the process and speculate.
How long the investigation will take and how, what steps are going to have to be taken for the investigation to be completed?
I think that'd be a question for the Honolulu Fire Department.
Given that everything's on the table, you don't know really what caused this. Is there a concern that you should maybe do something differently to make sure that this doesn't happen again? Is there something that can be done along those lines? Or?
And that's a good question. And last night we all discussed this as a team. We discussed this morning. Is there anything we need to change operationally immediately based on what we know right now? And the answer to that is no. So we are not changing anything operationally, but obviously if anything does come of the investigation that will give us information on best practices or something we should do differently, of course we'll do that.
Can you talk to us about how long the ambulance was in service? Is it an older ambulance? When it was got into service, that kind of thing?
We can make that information available. I do know it was a model that was, I think, built 6 years ago. But as far as the details, we can get you that later. I don't have that right now.
Is there any concern about providing services with one ambulance out of commission now, or is that not a big issue?
Fortunately, we do have backup ambulances that we can put into service, and so that's not a major concern. And like I said, American Medical Response, the private ambulance provider, has put an ambulance, and currently as we speak is covering the windward side for us to help augment our resources there. We have an ambulance in Waimanalo, Kailua, Kaneohe, and then one up in Kahuku. Fortunately, last night after the incident, it was a slow night on the windward side, a very slow night, so that was fortunate. And we're appreciative of the support we can get from our partner agencies, including the Federal Fire Department, who we can also ask to help us in the event that we need help. They have an ambulance on a Kaneohe Marine Base, and we have agreements with both them and AMR where if they need help, we'll go help them for calls, and vice versa. If we need help, they will help us for calls. So those are in place already, and that's helpful in situations like this when we need the extra coverage.
How many people were in the ambulance at the time of the explosion?
So we had 3 people: the patient who was on the way to the hospital, the paramedic in the back treating the patient, and the EMT who was the driver of the ambulance. The patient passed away. The paramedic in the back is in critical condition in the hospital now. The EMT was uninjured, who was in the front of the ambulance. And again, we've also provided support for him as well, peer support, and just making sure he's okay, because this is a very upsetting event for him, as well as all the people in EMS. This is their job. They go to emergencies, they take care of people in life-threatening situations, but when we as a team or one of the members of our department is the patient, it's just that much harder, and really for any first responder. So we're really just trying to be there not only for our critically injured patient, but also employee, but also the EMT driver who was there as well.
So our sources tell us that the patient had a CPAP or an oxygen cylinder at the time. Can you confirm any details about what the patient had with him and whether that could have triggered this blast, or how oxygen played a role in this?
So what I can say is all of our ambulances carry a device called CPAP. And CPAP is a breathing aid for people who are in severe respiratory distress. Hospitals have it, ambulances have it, and we use those in situations where we need to augment someone's breathing. All our ambulances carry oxygen. They carry oxygen in a main cylinder for the actual ambulance, and also portable cylinders that we can take into the house. So all of our ambulances carry that. You know, I don't have information on exactly what was transpiring in the back of the ambulance, and I don't want to speculate, but I think that will all be part of the investigation.
Can you at least give kind of the broader meaning of how often something like this would happen? You know, I don't know if in your history of working or if anyone up there can talk about how rare this kind of incident can happen. You know?
Well, I can tell you a fire like this is extremely rare, and if you even look at reports from the mainland, it has happened, but it's very, very rare, and in 30 years here, I've never seen it. Now, as far as how often we use this type of equipment, and I'm not even acknowledging we were using it on this call, but I'm just saying we carry it. We use oxygen every day on many, many calls, so probably a few dozen times a day. Chief Chalk is here. He's our professional standards chief, and he might have an idea on how many times we use CPAP maybe in a week or a month. Do you have any idea on that, CPAP?
We'll get back to them, Jim.
Yeah, okay. So, you know, so this is routine equipment used in emergencies. It's part of the standard operating equipment for an ambulance. But as far as this specific case, I don't have information on what they were using, if anything.
I was told that ambulances, you had put up barriers between the front and the back because of COVID, and that might have helped the driver probably in getting injured from this blast?
So what he's referring to, and I don't have any specific information on this particular ambulance or to answer your question, but their ambulance design is changing. And it used to be in the older ambulances, you could actually, from the front seat, crawl into the back. It was an open compartment. Some of the newer ambulances do have shielding to prevent airborne transmission between the cab and the back of the ambulance. Some of our ambulances have that, not all of them, but I can't comment on the specific ambulance that was last night because I just don't know.
Are there going to be any additional or any mental health services available to the EMS workers to support them during this time?
There will be, and that was initiated last night and will be ongoing.
Where is the ambulance now, and who is actually investigating it?
You know, it was at Castle, obviously, and it was towed. I don't know the exact location right now, but you know, the Honolulu Fire Department is the lead agency. I know we've been in contact with the ATF as well as other federal agencies. But again, I would defer any questions on the actual investigation to the Honolulu Fire Department. Yeah, I know we have 21 in service at all times, and backup we have another 25 backup. Generally, when ambulances get older, we decommission them. You know, I think in the news recently, some of the ones that were out of primary 911 service, we sent to the CORE program. We've also recently donated some to the Department of Education, and then if they're really at the end of their life, we put them up for in-city auctions when they've exceeded their life. But usually we try to keep, we have 21 primary ambulances, but usually we try to keep one backup ambulance for each primary. And Chief's telling me we have about 25 right now on the books that are considered backup.
Dr. Allen, can you please tell us why you were transferring the patient? Was it cardiac arrest, or can you?
You know, all that's medical privacy, and so it was a 911 call. We responded. It was in the Kaneohe area, and Castle was the hospital we were taking them to. And really, that's all I can say about the patient that we were taking care of, who ultimately passed away in the ambulance.
Were you able to get him out of the ambulance?
He passed away in the ambulance.
You mentioned that you met with EMS chiefs from other islands also, and they're watching this closely. Maybe although there's no operational changes that you mentioned, what kind of, I guess, what have you been hearing from our neighbor islands and how they're approaching things?
You know, one of the battalion chiefs from the Big Island came by today, and it was really more just offering their support, peer support, anything they can do to help, lend a hand for us, just like we would do with them if they suffered a tragedy like this. And it's more just, it's a small community, and you know, we're not a big state, and we lean on each other in trying times, and it was more just offers of support like we've got from Honolulu Fire Department, the police department, a lot of city council, a lot of folks have reached out to us, which we greatly appreciate. There may be avenues upcoming where people who want to offer other types of support we can let you know about, but right now it's just really too early to talk about that.
I know this is such a rare thing, but given that you're not changing as far as operations, what made you guys decide that? I mean, wouldn't there be a risk in something like that if there are no changes being made?
Well, I think we need the investigation to give us insight onto what the cause of this was, and that will give us information on what changes, if any, we need to make.